Actually, so the topic of the second talk is shining a light on safety, optimizing radiation dose management in the radiology procedures. The content of my talk is the first, the role of the clinical guidelines and protocols in ensuring standard, and second one is the radiation dose optimization practice, and the last one is the how to the South Korea's experience in radiation dose management, showcasing valuable insights gained from their effort in optimizing radiation dose. Yeah, as I mentioned earlier, is the radiology study is very increased in recent 10 or 20 years. So also radiation dose is also increased faster than 30 years. So like this. So this is due to increasing number of medical uses of the radiation, and especially the CT and MRI is more sharply increased. Actually, MRI is not contributes to the radiation dose, but CT is very sharply increased, and radiological exam marked increase. So the responsibility of the clinician is very important. Then, why is the responsibility of the clinician important? Actually, it's the international basic safety guide standard is by International Atomic Energy Agency. Is 2014. They said basic principles of radiation protection is like this. The first one is a justification, and second one is optimization, and third one is the application of those limits. But those limits cannot be applied by a medical exposure patient, because we use a medical radiation to diagnose a specific disease for the patient. It's a very special conditions. So we cannot we cannot make a limit for the specific situation. So the third one is the application of those limits is deleted for the basic principle for the medical radiation protection. So the clinician is a reporting clinician or radiologist is very important role because they decide to this procedure is needed for the specific patient. They have all radiation exposure is depend on the clinician's decisions. So the responsibility of clinicians is very important. So justification is what is justification? Justification is it right? Is the answer of the answer whether it is right or it is appropriate. So how do I judge it? Actually we are comparing the expected benefit and harm. We have to comparing the expected benefit and harm, and so if the benefit is more than the harms, we have to decide that you have to perform the procedure. So why radiation should be justified? As you know, this is Madame Curie, and there's the Röntgen. Madame Curie is a Poland scientist. She awarded the Nobel Prize twice. To her. First one is their development. They found radioactivity, and they found some substance for radioactive substance. So anyway, she died to leukemia and so aplastic anemia because they exposure to radiation during their experiment. So anyway, so it's the representative example for the radiation hazard. Actually, Röntgen is also also died by malignant tumor, but he is during the experiment he protects the lead protector. So why did the malignant tumor is developed anyway? So he is also died by the malignant tumor. And the radiation following the discovery of the X-ray, the use of radiation for diagnosis and treatment for human disease expanded worldwide. So benefits gains recognition is that it represents today the major contributor to human exposure to artificial sources. So modern technology is make a new application safer. However, the inappropriate, incorrect use can lead to unnecessary and unintended radiation exposure and risk. So some some scientist and the clinician is collaborate to make these guidelines. The justification for medical imaging is actually we call the bone call for action is in 2012, and they said that the great benefit for diagnosis and treatment is using radiation. Actually, radiation is very useful for the diagnosis and treatment. But if the benefit is great generally, it's a common sense, but is unnecessary exam is also justified. It's a different question. So they said it's appropriately prescribed is very important. So do the right procedure. We have to do the right procedure. It's an important thing. So the reason for unnecessary imaging is various. So one of these like this, and lack of awareness about the radiation exposure, and low confidence of clinical diagnosis, non-imaging diagnosis. And actually, so in Korea, the consumer is also demand their examination. And self-refer means in same hospital is a referral physician is asked the examination for the other radiologist in the same hospital. It's actually self-referral. Actually self-referral might be harmful to because if the hospital is actually intended increase, they can intend to increase the examination number for the income, is increase income. So it actually is self-referral is one of the reasons of unnecessary imaging. And opportunistic screening actually is not evidence is not enough, but the patient or there's some patient you wanted to screening for the I wonder that I have some disease or something. Actually we have to decide the examination is have to like based on the abundant evidence, but it's anyway. So opportunistic screening is also the unnecessary imaging. So and the next one is a lack of the communication between doctors. Miscommunication is between doctor, and the last one is defensive medicine. It's how do I prescribe appropriately and do the right procedure? So clinical imaging guideline, referral guideline is a practical method for enhancing justification. And its background is evidence-based radiology. It's made by a very objective manners. So it integrated the best available clinical evidence from the systematic research, and so we make a referral guideline. It's a very actually the procedure of the process of the make the guideline is very difficult for the yeah. Anyway, so indicate appropriate examination is it is indicate appropriate examination. So we use it as a decision supporting tool, and it is also indicate the radiation exposure levels. These are a kind of example of the clinical imaging guidance. First one is iRefer is made by the UK the Royal College of Radiologists, and second one is USA. It's appropriate criteria, and the third one is in Korea guidelines. We have made web-based guideline systems. Actually, the development of Korean clinical imaging guideline is started from 2012. So we are committee established, and we are study. We study how to make the clinical imaging guideline, and so we are going to IAEA technical meeting to learning about clinical imaging guidelines and the methodology of development, and we are. National evidence-based healthcare collaborating agency in Korea is help us to make the guidelines, and we are actually start to make a guideline in 2016, and we are maintain the development of guidelines. So we make 182 recommendations of 12 subspecialty is in 2012. 22. And this content is key questions like this. The first one key question is the example is what is the most appropriate method to decide the disease stage of pancreatic cancer, and the next one is following recommendation is following like this is a three-phase contrastiness CT is the most appropriate, and next is a grade of recommendation is a gradation is a grade is A, and the next one is the level of evidence is a level 2, and the radiologic dose level is the very high radiation because pancreatic CT is a three-phase contrast CT, so it's many radiation. You need many high level of radiation dose. So next one is optimization. Optimization is after achieving the justification of exam, and the principle is RLARA as low as reasonably achievable. So we are to make a best exam protocol, best quality management, optimizing the individual patient. It is the purpose of this purpose is to reduce the individual radiation exposure. What is the as low as reasonably achievable? Actually, the radiation dose and accurate diagnosis is more important. So first, accurate diagnosis, and then the radiation dose level is kept as low as possible. It's different among the institution. Actually, it's different. It might be different among the institution, medical device, and individual patients. So it is not recommended to forced reduce the radiation dose. But the first thing is the accurate diagnosis. How much do we lower the radiation levels? We are actually to lower the radiation level, we are the setting or reference level is very helpful to the lowering the radiation dose. And so we are use the routine radiology exam in the we are decide what actually for the make the reference level is we are data derived from a region-wide or nationwide survey. The survey is like this. Is the distribution of the radiation dose of from a survey is like this. So we set the 75th percentile of the distribution of radiation dose during a specific radiation dose exam is a diagnostic reference level. It means a little bit high, but it's not much high. So the higher 25 percentile hospital is we have to lower than the reference level is voluntarily reduced. They can voluntarily reduce. Actually, it is not regulation. It's not forced to reduce. It's just voluntarily reduce, make voluntarily. And actually the purpose of the diagnostic reference level is like this. Is the medical facilities identify their radiation dose is abnormally high or not. So if they identify their radiation dose is high, they have to try to reduce the radiation dose below the diagnostic reference level. So this procedure is optimizing the reducing patient critical exposure from the radiological examination at the facility, regionally, and nationally. So we make in Korea is also make a diagnostic reference level for the radiology exam. Various radiological exam. Actually, it's a second survey. From a second survey, so we have the first survey is in there. It's the recent second survey. This is evidence of the trend of reduced dose with dose reference level. Actually, this is conducted by United Kingdom, and they have a large amount of the experience of the diagnostic reference level for 20 years. So they repeated survey on 1985, 1995, 2000, and 2005. So those level of 2005 review is about 16% lower than the 2000 review, and typically less than the 50% reduced before, compared with the original 1985 DRL is nearly about 50% reduced. So actually, it's a nationwide survey is very, very difficult to make. So it's we had many software is developed and is automatically recording the radiation dose for the individual patient. So it's if you can use this program, it's very easily to record the radiation dose. And the last slide is the after justification and optimization of medical imaging is very important. And securing to secure the justification is the radiation examination. Is we have to the clinician have to decide this examination is very necessary to the specific patient, and if the benefit is better more than harm, is the study is performed. And there is any replacing technique, we have to consider another analysis, another examination. And after the justification and the setting of optimization is performed. And setting up the optimization strategy, they have justification, and we have to remember as low as reasonably achievable. The diagnosis is the first, and reducing radiation dose is second. So quality is even important, but remind the best quality is not always best. It means we have to diagnose a little bit poor image quality, but it's best. Actually, radiation dose is as low as reasonably achievable for the diagnosis. Thank you for your kind attention.